HIE stands for hypoxic ischemic encephalopathy. It is a radiological diagnosis. What it entails is a person who has had a lack of oxygen for whatever reason. In an adult, maybe they've had a cardiac arrest. In a child, it can occur when they're coming through the labor and delivery process if they don't have adequate oxygen to withstand insult to the brain, injury to the brain. A radiologist looks at an MRI and they can see these very established changes in the brain, and they will give a person the diagnosis of HIE, hypoxic ischemic encephalopathy. If you are given that diagnosis, or your child is given that diagnosis, you know, unfortunately, that they have an irreversible injury to the brain as a result of not having enough oxygen. If it's an infant and it's a situation where there was some difficulty during the labor and delivery, unfortunately, your child may go on to develop cerebral palsy as a result of the HIE. Often they will. In that type of situation, I encourage you, if your child is given the diagnosis of HIE, to come talk to an attorney. That's what we do every day in our office, is look at patients' medical records and determine if everything was done appropriately and whether or not a hypoxic injury to the brain, an injury to the brain for as a result of not getting enough oxygen, could have been avoided.